So what does tuberculosis look like on a chest x-ray? It can look like a lot of different things. Here's one example. You got these patchy opacities in the right upper lobe. You would call these consolidated opacities because there's areas where you can't really make out the lung markings. Compare that to here where you see those little lines and they're pretty much blocked out over here. Not seeing much in the way of mediastinal adenopathy on this patient. These lymph nodes look okay so far. Here's a different case. Tuberculosis can also be cavitary. Here we see this thick-walled cavitary lesion in the right parahilar region. You can see that central area where it's not really happening over there, and then this thick wall, particularly along the medial aspect. And you can also have what's called miliary tuberculosis, where you get all of these little dots all over the lungs. This is kind of like disseminated active tuberculosis. Sometimes the lungs can be clear and all you really get is this hilar adenopathy like we're seeing over here. If it spreads to the spine, you can have what's called Pott's disease over here. This is a post-contrast image of the spine. You can see this vertebral body and the disc is completely destroyed over here and it's kind of jetting out into the spinal canal. Here's your cord over here and it's getting pressed, and you can see this little bright signal over here. That's going to be indicative of a spinal cord injury basically. Hope that helps you guys out.